Good morning, everyone, and thank you for being with us today. I'm Dr. Grace McComsey, Principal Investigator of the case Western Reserve University, CTSC, as well as the Vice President of Research and Associate Chief Scientific Officer at University Hospitals. On behalf of the CTSC, and I'll tell you a little bit about the CTSC in a minute, but on behalf of our CTSC, I want to welcome you and thank you for joining us. I know everybody's busy these days. This is the fourth and final challenge in our Mission Health Equity Challenge series. This is a CTSC Health Disparities Un-meeting, sparking conversation to enhance health equity research. So before we begin, what is the CTSC? Stands for the Clinical and Translational Science Collaborative. It's a collaboration among Case Western and its affiliated hospital system. And that would be hospital systems. And that would be the Cleveland Clinic, Metro, University Hospitals, and the VA. And we recently added two other regional sites, University of Toledo and NeoMed, to our collaborative. So what the CTSC aspire is to be a catalyst for high quality clinical and translational research, both locally, and we work nationally with a lot of other CTSAs. So we want to change the culture, we want to change the environment of research. We share resources and expertise. We're funded by the National Institute of Health. And we streamline the research process. We want research to go fast. We want it to move from bench, from the lab to bedside very quickly and to the community. And that last piece actually was not really enforced in the past, I would say, but recently we woke up to the fact that it doesn't matter what inventions we have. If we don't take them to the community, they really mean nothing. So we can't do this work without you. And I want to thank you again for being with us. Without further ado, I want to introduce you to the chair of this meeting, Dr. Sherry Boland, who's the Director of Population Health Research Institute at Metro Health System. So Dr. Boland, thank you for doing this, and the floor is yours.
Great, thank you, Grace. Good morning, everyone. As a member of the Cleveland CTSC Community and Collaboration Core, I'm delighted to be with all of you today for this Un-meeting. My own career has been focused on providing outstanding clinical service as a primary care provider at the Metro Health System, and I'm also a health services researcher that works on improving heart health. I'm delighted to have this conversation with all of you today on the topic of health equity, and think about how that might be used for work that I do moving forward and future collaborations. So really excited about this today. On the next slide, I think, is our definition of an Un-meeting. So this is actually my first Un-meeting, so we will learn this together a bit. And some of you may have been to Un-meetings before, but this is really an event without the rules and structure of a traditional conference, where the interests and ideas of attendees, or all of you, drive the topics of discussion around a common theme, which in this case is health equity. And next slide. Oh, are we doing a poll? I guess we're doing a poll. So I didn't realize we were doing this, but I guess go ahead and finish the poll here. And if there's anything more we need to say about the poll, feel free to share that with the group. But thank you. I think this is to give us a sense of who all is joining us today. So I don't know who's ending the poll, but I guess just let us know when that is finished and if you're going to share that with the group. Great. So you can see here some of the responses, and you can scroll through and see who is with us today, as well as whether people are a fan of the daylight savings time, which is interesting that there's actually a pretty mixed response to that. So that's interesting to know from this group. Some of you may still be struggling with that recent change. So thank you. So looking at our unmeeting, what are some of the principles for the unmeeting? One is really discussion, as I mentioned, driven by interests and ideas from all of you. It's meant to be interactive, have us making productive connections across different sectors. So you'll see academic centers, industry, government, and community. And we hope, since this is part of the CTSC, that some of this will be a catalyst for future collaborative research, grant applications, manuscripts, and others. And this is our unmeeting team that have worked on planning this. I'd like to really call out Jaleese Thomas, who, as Grace mentioned earlier, has really spent a lot of time getting the whole health equity series that we've been doing for the CTSC and has really planned this day for all of us today. So thank you, Jaleese, for all your hard work. And again, feel free to jump in if I say or do anything that is not what you were envisioning and you want to correct me. And I know that many others on this team work to help make this unmeeting happen. Thank you. So what are the unrules? So really, again, you dictate the conference, allow all voices to be heard. We do want to make mention that this is collaboration and not promotion. So we really don't want you to talk about, selling your services or products in any of the discussions, but happy to hear about the work that people are doing. And then there are no wrong questions or answers, and pick topics that inspire you the most. And we have a packed agenda, as you will see here today. The morning will sort of mirror the afternoon in terms of what we do. But we're going to have we'll start with these 4x4 presentations, which really means 4 minutes and 4 slides by each of our presenters. And then we will move into a breakout session of your choice. And during the breakout, we'll hear from each of you and have some of the discussion. And then after that, we'll do a 5-minute report out. And then at the very end of the day, some breakout summaries of what's happened the whole day, or some synthesis of the whole day. And then after the morning session, we do encourage you to join our engaged break. And then we have our 4x4 presenters who are going to be presenting today. Thank you very much. In the morning, we have Dominic Hobson from Neighborhood Family Practice, Golnar Firasta from the LGBT Community Center of Greater Cleveland, and Sharita Mullins from the Burton Bell Car Development Incorporation. And in the afternoon, our 4x4 presenters are Dr. Deborah Duran, who will be from the Senior Advisor for the NIH National Institute on Minority Health and Health Disparities, Dr. Philip Alberti, Senior Director of Health Equity Research and Policy and Founding Director of the Association of American Medical Colleges Center for Health Justice, and Dr. Kavita Shah Arora, the Director of the Division of General Obstetrics and Gynecology and Associate Professor at the University of North Carolina, Chapel Hill. So thank you to all of those 4x4s who are with us today. And these are, as you can see, the many people who have registered and are in the room with us today, both in the region and nationally. So really excited to have all of you together with us. And our breakout sessions, we really have 6 breakout sessions. In the morning, the top row really reflects our morning breakouts and the bottom row reflects our afternoon. And in the morning, we'll have topics around community, including the role of community health centers in addressing health disparities, how community health organizations provide scaffolding for those left behind in healthcare institutions, and community development corporations and how they define their role in public health. And in the afternoon, we'll focus on diverse data science and systems, health equity research, implementation, and evaluation, and physician activism in the age of health equity. And I want to thank our moderator and catalysts who will be helping us to sort of facilitate discussions and help us with the discussions in our breakouts. So thank you very much. It is a diverse group of researchers, clinicians, and graduate students that are helping us do that work. So thank you to all of you, Dr. Jessica Cook-Bailey, Braveheart Gilani, Tyler Coy, Dr. Yasser Terabici, Dr. Shannon Walker, and Mary Louise Tatum. So thank you very much for fulfilling that role and helping keep the discussion happening. For some housekeeping pieces, if you're having any challenges, just contact Jaleese Thomas and Shannon Switkowski via direct message in the chat if there's any problems or issues. We want you to be social throughout the meeting, so use the hashtag CTSC Un-meeting to be a part of the social conversation on Twitter, and you can tag us at CTSC Cleveland or at ClickCTSA as you're putting in your Twitter remarks. And we will have a post-event survey. This is the first time we've done an Un-meeting, so we want to know what you liked and what you didn't like so we can make improvements in the future. The Un-meeting is being recorded, and that is so that we can post this on our YouTube channel, and that allows you all to go there afterward and see anything that you may have missed, because we do, as this is an Un-meeting, people may come and go throughout the time frame. And then the next piece is really to get us started. So I know that was a lot of housekeeping in the beginning and sort of description, but we'll really jump into our Un-meeting. And that will start with our 4x4 presentations. And the first one I will introduce is Dominic Hobson. He's president and CEO of Neighborhood Family Practice, and he's going to provide the framework for the role of community health centers in addressing health disparities. And I think he is going to share his own 4x4 slides. So we will let him share screen and follow up.
Well, good morning, everyone.
Good morning.
Let's see if I can get the slides up here.
First challenge of the day.
Let's see.